Okay, thank you very much, Susanna, and welcome and hello everyone. I'm actually not going to talk about my research at all, because here we are in the middle of this coronavirus crisis, and it really led me to think about how would the world be different if we had democratic supranational organizations, right? How would we have dealt with this crisis differently if these things were already in place? And so really what I'm talking about now is just the beginnings of a kind of brainstorming about this, right? So this is not based on research, this is just the really early thinkings, but I think this opportunity gives us a stimulation to think about these things. And so I'm going to talk about what if we'd had, instead of an international World Health Organization, if we'd had a supranational, let's call it global health organization. Okay, how would such an organization have reacted and responded differently to the initial outbreak in Wuhan? And if I have time, I would also like to talk a little bit about what if we had supranational economic organizations and how would they respond differently to the economic crisis that we find ourselves in today? So this is obviously a thought experiment, a kind of let our imaginations fly. So let's just sort of think, what would this global health organization that was supranational look like? On its basic level, how would it be different from the international WHO that we have now, right? And obviously international means that it's at the same level as the nation states and is trying to kind of coordinate them to help to voluntarily cooperate with each other. Whereas supranational would mean that it's a level above and has some power, right? And we would decide what particular limited power above them. But I think if we look at just the short history of what's been happening now, we would see that whereas an international World Health Organization has had to kind of try to cajole competing states to cooperate, right? To try and be very nice to China so that it lets in the inspectors to come and have a look and try not to annoy America too much, and then annoy America too much, and then they pull out the funding, and it's stuck in this dance of basically contemporary geopolitics, and it's right in the middle of that. So a supranational global health organization would be above that. It wouldn't be stuck in these geopolitics, and it would also not be dependent, I would suggest, on member states for funding. And I'll come back to that. Second of all, it would have its own direct system of medical surveillance already in place. So it would know if a new disease emerged, even if the government of a particular country or a state didn't actually inform it. Right? And this isn't such a crazy idea because the US National Center for Medical Intelligence already has basically such a medical surveillance system, but it's under the control and serves the interests of one country, of the US. And perhaps they share that information with their allies and not with others, right? So we just want to take that from one nation up to a sort of global organization that can use that information for everybody. Then it would also, I think, have real powers, right? In a way that the World Health Organization doesn't really have any power to act or to penalize a country for not acting, or indeed to act itself. And then also, as I said, it would have its own direct source of funding. And what I would propose here, that this would be through global taxes. So taxes that are paid directly from citizens, and we can look at in a moment who and how, but that would go directly to the Global Health Organization. So not via state governments. And I think seeing the history of what's happened now, this would mean that it has a sort of independent and secured source of funding that a particular country can't suddenly choose to cut off its funding in the middle of a pandemic or at any other time. And lastly, it should be run democratically, right? So not for the interests of certain states or for certain corporations or for the pharmaceutical industry or for anybody else, but for the global public good. Say such an organization existed. What would have happened when this new coronavirus emerged in Wuhan? So first of all, because of the surveillance system, it would have had clear and early information that it would have had directly. And second, I would propose that this organization would actually have the power to enforce a closure of the relevant area. And again, we can discuss would that be Wuhan, Hubei, China, right? But not to allow people in and out, right? So it would be able to do the typical containment measures that we all know are necessary for contagious diseases. Now, China did contain things in a certain way very quickly, but what happens if this disease had happened in a country with a much weaker infrastructure and ability to contain? What happened in the middle of the Central African Republic or the Democratic Republic of Congo or Ethiopia, right? Like, not all countries have the ability that China did have. And secondly, even with China, we still had flights leaving China with people, right, spreading the disease around the world. So I would say that if we had a supranational organization, it could actually impose a proper closure. And obviously it would have the powers to repatriate foreigners and visitors back to their home if need be, but only if their national governments organized quarantine facilities and that was all done safely. Now, such an enforced closure, especially if it was enforced sort of from outside, right, is very obviously a big deal. And it obviously has economic costs for the enclosed area and for various other industries, flights and so on. And I would suggest that because this area is closing down for the good of everyone, right, for the good of the world, that they actually shouldn't have to bear those costs themselves, that the Global Health Organization would actually bear all or most of those costs, right? So we would have a system, perhaps, where a global health organization would give grants, not loans, right? We're not talking about getting into debt. Would give grants that would cover, let's say, 80% of these costs. And in this way, if a disease originated somewhere, the state where that disease originated wouldn't be penalized for acting quickly and for taking the necessary precautions. It's just something to think with. So now the obvious question, well, where would all this money come from? And again, this is back to the question of global taxes paid directly to the Global Health Organization, or perhaps to a sister economic organization that would work alongside. Now, there'd be lots of options to think about how could we organize such a tax, right? It could be a universal health tax or a universal pandemic tax that's paid by everybody. Or we could think of a more progressive sort of tax, like it could be a wealth tax. And people like Thomas Piketty have done sums, and a 1% global wealth tax would raise $1.56 trillion a year, which is a huge amount of money. And if we wanted to arrange it in a more progressive way, so that it's a higher tax on the wealthy and the lower tax on the less wealthy, so if we had a 2% tax on wealth above $4 million, that would raise $500 billion a year, right? So anyone that owns that has wealth worth less than $4 million doesn't pay any tax at all. Okay. Another option when we're thinking about taxes, we could also try and have the principle of, well, the organizations or the people that have somehow led to the causation of the disease should bear some of the costs. And we know that many of the diseases now are coming from animals to humans in a process called zoonotic spillover, where basically the disruption of the natural environment and of natural ecosystems is causing diseases to move from certain animals, from pigs, from bats, from so on, into humans. So we know that in an indirect way, that it's industries that are really disrupting the natural environment are sort of basically leading to the increase in these diseases. So we could tax those industries, right? So essentially, we could make this externality of their business costs, we could make them internalize it. Anyway, we can discuss all the different options, but I think there are many ways that we could raise this tax in a way. Now, no one likes additional taxes, but I mean, looking at the mess that we're in now, right, and how the international system and the system that we're in now really hasn't worked well. If we look at the numbers, if we'd had a tax like this and a system like this, we would have saved a huge amount of money. Just recently, the IMF has estimated that the global economic cost of the COVID-19 pandemic will be around $9 trillion. Now, obviously, we can take all these numbers with a pinch of salt because no one really knows, but let's play with these numbers. $9 trillion as the total cost. Now, let's imagine that we had managed to contain it in Hubei, right? So I'm thinking, what would the cost have been then? And I think we're looking at figures that have been floating around. The cost to the Chinese economy due to the lockdown in January, February 2020 was around about $200 billion. We can estimate that the cost of the loss of money from flights to and from China that got cut and reduced in that time is another $30 billion. And I'm sure there are various other costs as well. So let's just round it all up to 500 billion, right, to be on the safe side. And the numbers would seem less, but let's put it all up. So let's say the cost would have been 500 billion, right? That's a hell of a lot less than 9 trillion. Okay, and so if our global health organization with our taxes had paid 80% of that 500 billion, so it would have paid 400 billion to China for the containment that has saved the rest of the world all this disaster that we're all in, it would have saved all of us round about $8.6 trillion, as well as hundreds of thousands of lives. So I would say that something along these lines is really worth thinking about, because, you know, one might say, oh, but what would happen if this organization did this or did that or did some bad things? It could lead into so many problems. But then we can look in the other way with, like, wow, without this organization, look what's happened. Hundreds of thousands of people have died, trillions of dollars are lost. Yeah, there's going to be a huge economic cost to all of it. So worth thinking about. And also, obviously, there are big questions about how this organization should be run, because it's would obviously have quite a lot of power. And just some initial suggestions to sort of start with. I think its decision-making bodies should have a balanced representation from all regions of the world, right, including politicians and experts. There should also be some kind of worldwide direct citizen involvement, perhaps a committee of elected representatives, perhaps some form of citizens' assembly where people are nominated to sit on it randomly for a set period of time, rather like jury service. I think there should also be strong processes to ensure transparency and accountability, right? Everyone would need to know what's going on, how decisions are made, and so on. And it would need to establish clear working principles and guidelines with regard to how it responds to a pandemic. So these are kind of well known by people and would be broadly similar everywhere, obviously adapting to local circumstances as necessary. And such an organization, however democratically we organize it, should still in itself be overseen by another organization, most likely some kind of global parliament, which I think maybe one of our speakers might discuss in a moment. So it's an interesting thing to think about. And I think even if we look at the situation that we find ourselves in now, so even if we'd had a new disease and it somehow had spread, even with our global health organization, and we've now got the disease everywhere, still in our situation now, how would this organization, how would having a democratic supranational health organization be better than what we have now? And I think there are a number of points that immediately become obvious, because at the moment, if we look at data collection, right, scientists all around the world are finding it incredibly hard to actually know what's going on with this disease, right? Not only things like how many people are dying and how many cases there are, but ratios of men to women who get ill, what underlying diseases seem to link with it, what genetic issues, right? And the problem is that each country has their own standard for data collection. So they measure different things. Sometimes it's disaggregated by gender. Sometimes other countries it's not disaggregated by gender. Sometimes it's disaggregated by age, sometimes not. And so with each country having a different system, it's very hard or essentially impossible to collate it all and look what's happening at a global level. So if we had a global health organization, we could have a shared universal system of data collection and aggregation, measuring the same things in the same way so that we'd understand what's going on. I think also a global health organization could share information very widely about scientific research and also facilitate research collaborations. So instead of having each country kind of competing with each other to try and sort of doing the same research, we would have a much more collaborative and coordinated system. And, you know, finally, or really quite importantly, they would also be able to ensure that any vaccine or any treatment that was produced would be available to everyone at an affordable price by some system of pooling intellectual property rights. Now, as I'm sure many of you know, in the last few weeks and months, Costa Rica has made a proposal to the World Health Organization that raises many of these issues and has suggested that countries should agree to something along these lines and to pool international property rights and to make sure that vaccines would be available to everyone. But as far as I know, this is still being discussed and states haven't all jumped in to agree. because we're in our current system is a competing system of international states, right, who are competing with each other in order to profit from the crisis. So the dynamic is completely the wrong dynamic. Whereas if we had a global organization, we could run things that way. I think also, if we look, we see the same dynamic when it comes to the production and distribution of PPE, personal protective equipment, right, which has been a disaster basically in virtually every country so far in this pandemic, where we have a competitive system where buyers from different countries are competing with each other to get hold of this equipment. And we've heard stories of buyers from one country literally stopping a plane on the runway and that was headed to another country with PPE and offering to pay them more if it'll take it to their country. I mean, crazy stories, and I'm sure there's many stories that we haven't heard. And all of the result of all of this is that the cost of PPE goes up like 4 or 5 times, and that the distribution is such that it ends up in the hands of the rich and powerful, and it doesn't end up, countries in Africa, for example, can hardly get any of it, both because of the price and just because they can't actually fight in this competitive system. So what about having our global health organization that would actually maybe buy all of the PPE and then distribute it according to need, right? Or something along those lines. I mean, how it is now is just ghastly. And I think if we were in a system, I mean, most likely if we had a global health organization, we wouldn't get to the situation where we are now, where like most of the world is in some form of lockdown. But if there were lockdowns necessary in several places, the system where the Global Health Organization would cover the cost of those lockdowns would enable more states to be willing and actually able to impose the necessary short, sharp lockdowns that can contain a disease. And I'm thinking not only of like countries that really are unable to do it because of their social economic situations, but also countries that don't want to do it at the moment because of the economic cost. I won't name names, but I'm sure you know who I mean. So I was also trying to think about how would we respond to this big economic crisis that we're in at the moment if we had supranational organizations as well. And at the present, if we look at what's happening, we see that basically wealthy countries are able to finance the problems at the moment either by taking on debt or printing money, basically by monetary solutions. But if we sort of break that down a bit and look at, well, who are we taking debt from, and where is the flow of money here, right? So countries issue bonds, and bonds are mainly bought by national or global elites, right? The so-called 1%. These are the same people who mainly own the big corporations that are actually receiving the bailouts from the government. And they're also the 1% that basically put most of their money in tax havens to avoid paying taxes to the governments. So we have this sort of, the current system is actually having money flowing from citizens to the elite, sort of now through the bailouts, and in the future for all our children, our grandchildren, on the interest payments to the debt, which is very, very problematic. And if we also then look at what's happening in, well, let me just jump because I can't give you the whole presentation here. But poor countries can't actually do that at all, right? They don't have any rate to issue bonds at the moment because no one's interested in buying them because they already have huge amounts of debt and various other reasons. They actually can't really print money or use monetary solutions because if their currency is devalued anymore, then the costs of imports of food and oil and medical equipment, all sorts of things goes up. And even worse, there's been a huge outflow of capital from these countries during the corona crisis. So roughly $100 billion has flown out in the last few weeks, end of March and early April, which has led to their currencies devaluing. So the costs of their dollar debts have effectively gone up and the credit rating has gone up. And so they're basically in a complete mess. The time when they need money to deal with the crisis, they've got even less money than they had before. And there's various other elements around dollar liquidity and swap lines and so on, but I won't say that. But like, if we had a supranational financial system, an economic system, a monetary system, we could arrange all of this in a completely different way, right? We could have an IMF that would issue special drawing rights, right, which are essentially a unit of reserve assets, something like a bit of a quasi-global currency. which would essentially be monetary policy at a global level, right? To simplify massively, like printing global money and giving it all to the countries. And that's not a crazy thing, because that's what happened after the 2008 financial crisis, right? In 2009, the IMF issued $250 billion worth of SDRs and gave it to all the countries. And this was crucial to keep the developing countries mainly afloat. And just a few weeks ago, the IMF discussed creating new SDRs now in the current crisis. And the vast majority of the countries agreed to this, but the US didn't, and the US has a veto in the IMF, but effectively because it has 17% of the vote, and so it hasn't happened, right? So I think one of the things is a huge need to democratize our monetary, democratize the IMF, right? Possibly to have a completely new system, a democratic global central bank, to be at the center of a revamped international monetary system. I mean, we could really sort of change things, get away from the dollar hegemony. We also need to look at how we actually need to wipe debt, or at least restructure debt. Low and middle income countries are scheduled to pay $415 billion of debt into 2020, in the middle now of this crisis. So that's instead of spending that money on their health and welfare as used to be spending it to make profit for the creditors. Do we really think that's fair? Right? But if we want to think about how to actually restructure debt, and possibly to actually have a system where countries can declare themselves bankrupt, we would need some kind of global supranational sovereign debt tribunal, right? And that could make these decisions above the interests of particular states and particular creditors. So that's another supranational institution that I would like to call into being, if I can do that here, right? Likewise, tax. We need a global tax system to sort out this crazy tax system where the elites just put money in tax havens and don't pay tax. It's estimated that somewhere between $7 and $32 trillion are held offshore. And so if we take an average, let's say 20 trillion, we don't really know how much. And if that was taxed at 20%, then there'd be $4 trillion floating around of public money that could be used to sort out problems. So, you know, I think we have to include these things, right? And whilst the solutions might be incredibly utopian at the moment, we have to put them on the table, because the reality of the system is insane.